helped by the standard Q-depressant injection. We actually decided that maybe we could amplify the Q-depressant effect by adding some complex to the Q-depressant in the form of magnesium sulfate, cyanocobalamin, cytosine, which is basically a calcium catalyst, glutathione, folic acid, and in conjunction with immunoprop, which was L-cysteine and glutathione orally, and immunoplus, which was folinic acid. This all followed Rich Van...
I can't remember his last name. I'm sorry.
Rich Van Camp had this idea that this was all part of the methylation cycle, and that our therapy actually fitted with the methylation cycle abnormality, and he was very helpful in the formulation of our approach. We then actually had a patient come from Barcelona who asked us what we thought about the Blasi formulation, or electrolyte formulation, called recuperation. And recup, we found, was an electrolyte supplement which actually helped in muscle fatigue and muscle pain. So we actually added that to our method of approach. And lastly, actually, we found that if we gave actually methylcobalamin, methyl B12, sublingually by spray, it actually was absorbed almost immediately, and eliminated the need to give methyl B12 by injection.
So you do have a treatment protocol, even though we're dealing with a disease for which there have been no specific medications approved by the FDA ever.
Correct. We're not making actually massive claims, but we have found that 60% of patients are helped with this protocol. Is this a cure for the disease? No, this is not a cure for the disease, but it actually certainly does actually bring patients to a point where they can actually perform certain tasks. Some of my patients actually are bedridden with this disease, and it actually has improved actually the status of patients, allowing actually some patients to go back to work or go back to school.
Can you tell me what your thoughts are on Ampligen, which is a drug that's been in trials for decades and still has not been approved by the FDA, and there's been some positive reports and some negative reports?
Ampligen was originally suggested by DuPont. DuPont actually shelved the product, and it was actually then the patent was purchased by a private organization called Hemispherics. Hemispherics actually took the patent, and I have actually been proceeding with the research into ME/CFS for many, as Jay says, for many years. The Ampligen trials are still ongoing, and we've been asked actually to participate in the Ampligen trial. So this actually will proceed in 2010.
It has a big question mark there, because I know people who seem to have done well, and then I have read of people who have not done well. It's just very frustrating that in all these years that they just they don't seem to have gotten very far. Now, in your office, you've been using a I don't know if you call it a technique or a machine or a treatment. But you have that machine inside, that EECP.
EECP. It's basically counterpulsation, which EECP was originally used in chronic heart failure. The idea being that it uses cuffs which are put on the lower extremities and also the lower abdomen.